Welcome, everyone. My name is Yonas, and today we're going to talk about men's health in regards to physical therapy. And a lot of these topics, they're taboo topics. They're things that normally people don't talk about, but a lot of males have these issues. So it's very important to talk about. And I'm just here to kind of break the ice, just so we can learn, because the more we know, the more we can treat what's going on. A little bit about me. My name is Yonas Tekeste. I was born and raised in Chicago. And I went to U of I in Champaign for my undergrad. I was a psychology major. And then I went to physical therapy school as in Missouri at Southwest Baptist University. So I got my doctorate in physical therapy. And I graduated about 7 years ago. So time flies when you're having fun. And I'm currently working at the University of Chicago Hospital in the outpatient setting. I'm a travel physical therapist. So with that, it's kind of like a travel nurse where you just take a job for about 3 months and you travel somewhere else. So it's been a good way to just explore, and it's a good way to learn and grow. And then these are just pictures of me. This is a picture last summer. I went to Europe for 2 months, and that's on a mountain in Switzerland. And also as a travel PT, I've worked in a lot of settings as a physical therapist. Like I've worked inside of a hospital, in the ICU, in nursing homes, in the home care setting, in the outpatient setting, and I've seen a wide range of patients, like from age 0 to 105, and like just with so many different types of conditions. But today we're going to talk about pelvic floor physical therapy, because most people are not sure what that is. And I wasn't at first in when I was in PT school. So so why pelvic floor? Why am I talking about pelvic floor? And the main reason why is because a lot of the older patients I would see, they would have difficulty peeing, or they would just pee themselves on their own, and they were ashamed of it. Because I would see a lot of patients for one job in the home care setting where I see patients inside their homes for physical therapy, and a lot of them would wet themselves and they would have issues just with going to the bathroom. And a lot of the times when someone goes to a nursing home, it starts with an issue with their bowels, because they try to go to the bathroom at nighttime and maybe there's a fall or a fracture, and it sends them to the hospital. But essentially, I would see so many patients that are older where they would have issues with controlling the ability to pee, and it's very common, but it's something that's not talked about, and there's a huge need. And a lot of men have these issues, but it's not talked about at all in the USA, and especially in the Black community and in the Eritrean community as well. It's kind of like men are forgotten, and a lot of men, they actually suffer in silence. Most men wait until it gets very bad, and then they seek out help. But by then, it just is tougher to treat. And some other crazy stats is men have a lower life expectancy than women by 5 years, and they also have men with emotional retraction. So it's like men that don't cry, or they don't say what's going on if they feel bad. They have greater than 4 times of a risk of getting a heart attack. And compared to women, so women are way more likely to seek out help when there's an issue, compared to males. And it's for different reasons. I mean, it could be cultural reasons as well, or maybe because men are supposed to be strong. We're not supposed to have problems. And some other crazy stats about males, and these are just crazy, but males are more suicidal. Um, they commit more suicides, and they do it more successfully. They're more likely to not live in a home, to be homeless as well. And males also have worse outcomes in every category compared to women, like cancer or cardiac issues. Like males, they just have worse outcomes in every medical category compared to women. And a part of that is because they don't seek out the help when it's a problem. And a lot of women do seek out helps when a problem is small. And one last stat is Black males, or people of color, they have a big increased risk of getting prostate cancer as well, compared to non-black males. Sorry, guys, I got something. I'm just gonna wipe my something in my nose. There we go. And this, so black males are more likely to get prostate cancer. So it's very important to check. But this is not common in the military, because in the military, everybody gets good quality care. So black males are not more likely to get prostate cancer in the military because everyone gets care. But outside the military, it's way more common for black males to get it. It's because of the lack of access to care, and we just don't seek out care. So we'll talk about that. But that's kind of why I am focusing on pelvic floor, because there's so many issues that nobody wants to talk about that everyone goes through, and they could be really life changing. And this is a pretty much a crazy picture, but it just kind of shows generally like what's going down there, because most of us, we don't really know what's going on in the pelvic floor. And if you guys have questions, feel free to raise your hands or shout it out, because I might just run through this quickly as well. But this is just the pelvic floor here and here. And sometimes it's kind of weird to talk about this, because honestly, when I think about it, as a kid, my parents would never talk to me about this. And these are things that people don't talk about. But sometimes if there's an issue down there and no one talks about it, we just accept it and we suffer in silence. So it's just good to be aware. And I'll kind of talk about like what are some signs and red flags as well. But real quick, this is just here on the left. This is the rectum where you poop from. This is the penis where you pee from, right? And then this is the prostate right over there. It's like the size of a walnut. And on top of that is the bladder. So this is where when you have to pee, this gets filled up with fluid, right? And then it travels through the urethra and it goes through the prostate and then it comes out the pee hole. But a lot of the times, if there's an issue with the prostate, it can kind of push on the urethra and it makes it tougher to pee. And the pelvic floor, there essentially are muscles throughout this area. It's kind of like a sling. And the purpose of the pelvic floor muscles is they assist you to pee, poop with sexual function, and to support the organs down here, all the pelvic organs. So they're very important. And also another cool thing is there are so many nerves in the body. One crazy stat is if you were to put all your nerves on the road, it would take 45 miles of roads to fit all the nerves. So our bodies are so amazing and they're so uniquely designed. There's 45 miles of nerves. And what that means is everything's all connected. So sometimes if someone has pain, let's say at the back of their hip or down their knee or down their ankle, or maybe at the groin area, sometimes it can come from somewhere else. It could come from maybe the spine, from the hip. It just depends on what's the nerve pathway. But sometimes there is a thing called referred pain, where you feel pain at one area, but it's caused at another area. So you sometimes like have to be a detective to figure it out. But it's just pretty amazing, all the referral patterns. And then these are this is like another view of the pelvic floor muscles. I don't need to go into too much in detail, but it's it's pretty amazing because this is what we all look like underneath. And I'm gonna kind of talk, and I'm just gonna give like a brief overview of these conditions. These are the more popular ones, and so I'll talk about incontinence, when it's like difficulty peeing, um, pelvic pain down there. I'll talk about having an enlarged prostate. So over time, it's normal for the prostate to get larger. I'll also talk about prostate cancer because for our past president Joe Biden, now he has an aggressive form of prostate cancer. So it doesn't matter if you're a president, if you're or a billionaire. It's like these conditions affect everyone. And I'll also talk about erectile dysfunction as well. And this funny picture, the Pillsbury Doughboy here. So your bladder is just right underneath your belly button. So if you kind of like touch your belly button and go underneath that. And if you push on that, you might have to pee if your bladder is full. But that's where your bladder is. And when you push on it, you might feel like you have to pee. It's just right underneath the belly button. And then just real quickly, there's different types of incontinence or where it's tough to pee. There is stress incontinence. So for example, if you cough or sneeze, or if you run and you leak, right, and you can't control it. There's also the urge incontinence or the overactive bladder. So, for example, like think about it like there's a sudden urge to pee and it's maybe tough to let all the pee out. Or if you're peeing like multiple times at nighttime where you constantly wake up to pee. And there's also overflow incontinence where if there's like some kind of a block in the urethra, kind of like an enlarged prostate. So, for example, when the prostate gets larger, it can push on the urethra and then it can make it tougher to pee because the bladder can normally fill, but then it'll be tougher to get it out. So sometimes you might just pee little by little. And this is kind of like a model about what it's like to pee. I won't go too into detail, but just real quick. So typically during there's a muscle. So this is your bladder. So and then these are different phases from beginning when you don't have to pee up until you do have to pee. And it's pretty cool because there's a muscle around it called the detrusor muscle, and that helps us to control our ability to pee. But essentially, when you first drink a cup of water, um, so at about 200 milliliters, which is like 1 cup of water, you get your first sensation to pee. But if everything's normal, you don't pee. And then when you keep drinking more water, the the fluid fills, then you have more of a desire to pee. And then as your urine, as the fluid goes up in a bladder until it goes to about 2 cups, which is like 300 to 500 milliliters of fluid, then that really makes you want to go. And then in a normal, healthy bladder, what happens is the detrusor muscle, it contracts and then it pushes down the fluid, and your pelvic floor muscles here, they relax and then pee comes out. So that's the normal response. But in some of these cases, the detrusor muscle, it can be overly sensitive or overactive, where it keeps contracting and it makes you think that you have to pee when the bladder is very low. And that can happen with urge incontinence or an overactive bladder. So essentially the bladder fills up, but it's tougher to get it out. And then there's a lot of things that we could do with pelvic floor physical therapy, but just I won't go into too much detail, but different things is giving verbal cues to strengthen the pelvic floor muscles because we go to the gym, we think about like building our biceps, right? Doing bicep curls or doing a bench press to build our pecs. But we don't really talk about building the muscles down there, like the pelvic floor muscles. But sometimes if because there are muscles in the pelvic floor, there's a lot of them, but sometimes they can be too weak or they can be too tight and tense if we're stressed out, or the coordination can be off as well. So working with a pelvic floor physical therapist, we would address the issue and then do that as well. And also, it's good to also check your medication as well, because sometimes there's medications where there's side effects where it can make you pee more. And also the foods and drinks that we have, it can be a bladder irritant as well. So for example, drinks like alcohol, coffee. Oh yeah, we drink a lot of coffee in Boone in our culture. But drinking coffee at nighttime, it can make you go to the bathroom more. Or if you drink tea or pop or spicy foods, those are all bladder irritants. So it'll make you go to the bathroom more. And that's something to think about too. And even the amount of fluids that we're drinking and the times that we're drinking in. Because if you're drinking like 5 cups of coffee right before bed, that's a lot of fluid. But let's say if you drink those 5 cups of coffee maybe at noon, then you might not have to go to the bathroom at night as well. And we're gonna go to the next slide. But how's everyone doing? Do you guys think I'm going too fast, too slow? Is it, how's
Yeah,
the pace?
you're doing well. Yeah, keep it up, Yonas. Great.
Okay. Okay, I'm just gonna keep moving on. And next, we're gonna talk about prostate issues. So there's a picture here of Joe Biden. So he's the he's the past president of the USA, and they recently found out that he has an aggressive form of prostate cancer, which is very sad, and I hope he recovers well. Um, but no one is immune to this, so it doesn't matter if you're like a billionaire, if you're a president. But the prostate, all men have it. It's about the size of a walnut. It's very small. And then, like I mentioned before, and I don't want to scare you guys, but I do want to scare you guys if it'll make you get a check. But all males should be getting prostate checks, especially at age 40 or 50. If it runs in your family, then get it checked at age 40. What the doctor will do is they'll do a digital rectal exam, and it's really not that bad. It's not that painful, and it could honestly save your life. Because prostate cancer, it's very treatable if you treat it early enough, and it can be cured and resolved. But if you wait a long time, it gets bad and it can spread, and then it can be too late, unfortunately. So it's very important to get it checked, because it's not uncommon to get the older we get, but it's very curable.
Jonas, Mike is saying you going a little bit faster, just like when I check the chat message.
Hmm.
He wrote, maybe just uh for me, I think you're going at the right pace, but maybe a little bit you can be slower. You can go slower.
No problem. Thanks for letting me know. Sometimes when I get excited, I talk quickly, but I'm gonna tone it down. Thanks for the feedback. And there's also, as we age, it's normal for the prostate just to enlarge, and there's a condition called, it's just called benign prostatic hyperplasia. It just means there's an enlarged prostate, and this doesn't cause prostate cancer. This is something different. But the symptoms are, it's difficult to pee. You might have to pee more urgently, waking up at night to pee. Um, when you're peeing, it's the flow is not too strong. Difficulty peeing as well once you're starting, and just just difficulty peeing because the prostate, it can block the path of the urethra, kind of in this picture. So when the prostate gets enlarged, it just can cause issues because the bladder is right above it, and it can just decrease the space for the urethra, and then it causes problems once you have to pee. Whoops. And for an enlarged prostate, there the main treatments are medications, surgeries. I mean, there's so many different types of surgeries. And then for physical therapy, it won't cure it, but we can give better tips on managing your bowels and the ability to pee. But essentially, it's very common for the prostate to get larger. It's associated with with our age as well. And then we're gonna go to the next slide. Next slide, we're gonna talk about something that no one ever talks about. It's erectile dysfunction. So this, guys, like, thanks for being on. Thanks for listening as well, because these are talks that I don't talk with my parents, right? And I'm sure that you guys don't talk about this with your parents, but they're so common. So with erectile dysfunction, it's the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. And it's actually very common. So some crazy stats where it happens to people of all ages. So if you're under age 40, erectile dysfunction occurs in 25% of people. If you're age 40, it's in 40% of people. And if you're age 50, it's in 50% of people. And if you're 70 years old, it happens in 70% of males. So chances are someone that you know, or like a grandfather or a friend, sibling, it probably affected them at one point. So because when you're at age 70, it affects 70% of males. And this can be very tough if you're married with someone and it's a big problem. And also, even outside of taking a look at the penis, the if a male cannot get an erection, it's most likely a sign of a larger issue at your heart, because typically it's a circulation issue. So if there is bad circulation down there, there's more likely bad circulation at your heart. And it's kind of like a warning signal. If something is not working down there, there's probably an issue with your heart. There could be a cardiovascular injury, or it could be an early sign of something going on with your heart if a male has erectile dysfunction. And kind of one way that someone told me is the penis, it's like a compass to your health. So if that's not working well, it means there's bad circulation and there's an increased risk for a stroke, cardiovascular disease, or just any kind of issue with your heart. So I think it's very important to know, because if this is not talked about and if it's ignored, there can be a larger issue with your heart that's more vital. And some other causes of erectile dysfunction are diabetes, obesity, sedentary lifestyle, poor diet, smoking, doing drugs, vascular disease, and even medications. And it's all like a circulation issue, because with diabetes, there's less circulation throughout our nerves. If we're obese, there's typically less circulation, there's more inflammation throughout our tissues as well. But essentially, for a healthy erection, you need these teeth rings, these things here. You need to be aroused. You need to have enough testosterone. There has to be good nerves throughout the penis and good blood flow. And you have to have a healthy mental health as well. Because a lot of the times, if we're anxious and if we're stressed out, that can affect a person's ability to get an erection as well. And there's also yep. And then there's also, we can talk about the sympathetic nervous system. So there's in our body, a lot of the times when we're in pain, think of it like we're in the fight or flight response. Or let's say if someone is chasing you, right? And we have to breathe fast, we have to run fast. That's more so the sympathetic nervous system. And then when we calm down, when you go to sleep, if we do deep breathing, that's the parasympathetic nervous system. A lot of the times, if we're in pain, the sympathetic nervous system is overly ramped up, and that can make it difficult to get an erection, because there has to be a balance between the two where we're not always in fight or flight mode. So sometimes if we're always stressed out, if we're always anxious, if we're always busy, and there's a lot of going on and we don't calm down, that can be a contributing factor to erectile dysfunction. So if there's not a balance between relaxing and not relaxing, that can cause a big issue too. And another interesting fact that one thing that can affect erectile dysfunction is not getting a good sleep. And a lot of the times we might work a lot, or if we have a family, we can get like a lack of sleep. But one interesting fact is, when you sleep, a good healthy sign is if you're getting a nighttime erection. So typically, a healthy male gets between 3 to 5 erections at nighttime, and they're each between 15 to 25 minutes. And this only happens during your deep REM sleep. So when you're sleeping, right, the good sleep is called REM sleep, and that's when your body recovers, and that's when you truly heal. And also is during those sleep cycles where males get erections. It's kind of like a maintenance erection. So it's possible for someone to have an erection for 2 hours while they're sleeping if they're healthy. That sounds pretty crazy, but a lot of times if you don't get a full sleep, then your body doesn't fully recover. So getting a good sleep is very crucial, very crucial. And some other interesting facts was the average size. And guys, these are taboo topics, but it's important to talk about just so people know, because sometimes I think it's more in America. People think that their penis is too small, so they get anxious, or they just this might contribute to erectile dysfunction if they're anxious that they're too small. But the average size of the penis when it's flaccid and when it's pulled or stretched out is 3.6 inches, and the average size when it's erect is 5.1 inches. So most men think that they're not normal, and this can cause anxiety. It can cause them to do a surgery, but it's simply not true. And then with physical therapy, if somebody does have erectile dysfunction, we would figure out what's the cause of it, um, teach them ways to decrease their stress, deep breathing. If they have any tight muscles or if their pelvic floor muscles are weak, we would show them of ways to train it, and also finding ways to improve their overall health. There was even one study where it said if males walk 2 miles per day, it'll decrease their risk of erectile dysfunction by 70%. So just by getting up and walking, that'll get more circulation and that'll decrease the risk of it, erectile dysfunction. So guys, that is actually all. I actually went through this pretty quick, but if you guys ever have any questions, you can always reach out to me on Instagram, YouTube. I have like a free Facebook group. That's the name. You can send me an email. Happy to just chat. But I think these topics are very important because a lot of people have these issues and they can affect how someone lives their life. They're sensitive topics and it's good to be delicate, but they're very important and crucial. That's all I got, guys. Dasali.
Yeah. Oh, thank you so much, Jonas. This is very helpful. I know, as you said, most of the people, especially in our community, we don't feel comfortable. Let's see if my okay. We don't feel comfortable to talk about this kind of topics, but they're very crucial. Instead of just suffering, individual, it's knowing the information, is good to get treated. So I have a question. One of my question is like, you said there were, I think you mentioned like around like 45 miles of nerves. It is in the pelvic floor area or in all of our body?
No, just throughout the whole body. Throughout the whole body. There's 45 miles of nerves throughout the whole body.
Oh, I see, I see. Okay. And then the other question is a follow-up question to that. So how do you build, how do we build our, the muscle of the pelvic floor? I
Yes.
know age could be a factor and food could be a factor and things like that. But especially if somebody's above 40, 40 and above, what is the best way, to build up that area?
Definitely. And then quick question. Do you think I should keep the recording, Dasali, or should I stop
Yeah,
it
yeah.
now?
No, no, keep it, keep it.
Cool. Yep. Okay. So the question are ways to build the pelvic floor muscle, right? That's the question.
Yes.
Yes. So I think it's good to figure out what's the issue, because in some cases you might not need to strengthen it. Maybe it's tight and it needs to be stretched. But there are some cues to build up the pelvic floor muscles. So one cue, and there's many cues, but so for example, if a male thinks of it like think of it like you want to lift up your penis, or um like you want to bring your testicle upward towards you, those are like cues to contract the pelvic floor muscle. So just cues like that, or because you first have to figure out a way to isolate the pelvic floor muscles. And because a lot of times when people try to do it the first time, they might contract their butt muscles or their core muscles, and it might be tough to actually find those muscles. But one way, if someone's just starting out, there is an area on their body where you can feel them. So when you're on your own, you can touch. There's an area called here, I'm gonna go to the slide just to show a demonstration. So kind of here, in between the the testicle and the anus, there's an area called the perineum where if you put your hand there, and then you should feel if you're contracting the pelvic floor muscle. So if you just kind of put your hand, it's between the anus and between the testicle, and just trying, one cue is to shorten your penis, right? So by doing that, you should feel that part of your body, it should lift up or move. And if you're doing it correctly, only that part will move and not the rest of your body. So a lot of the times it's trying to get a patient to find that muscle and to figure out if they're doing it correctly too. And that's just like a basic contraction for that. So by doing that contraction, I shouldn't see you move at all. So it's like something that someone can do at home.
So what about using like other physical activities, like I don't know, lifting weights, it could be, or a
Yes.
chiro exercise. What about those things?
Yeah, that's all good. So even with pelvic floor physical therapy, it doesn't even have to be an internal exam where you like where you see them. You can like for the one study where it said males that walk 2 miles per day, they had a 70% decreased risk of erectile dysfunction. So literally just by getting up and walking or doing aerobic exercise or things that you like, whether it's biking or playing soccer, that increases the blood flow, which that's good for the pelvic floor. So it really doesn't matter what activity you do, but as long as you move, because one cause of these issues is just sitting all day on our bottom. Because if we don't move and if we sit all day, the nerves don't move as well, and there's less circulation and less blood flow. So just like by walking, playing sports, that's a great exercise. And trying to at least walk for it or exercise for 150 minutes per week, just a moderate activity. So that could be like 30 minutes a day, just 5 days a week. That'll make a big difference.
You see, okay. And then do you guys have any other questions? Okay, there's a question, let me see from the chat. Philmon, he put like this. So, hi, did I miss it, or you didn't talk about the digestive issues that cause bloating and then constipation? Thanks.
No, that's a so I didn't talk about constipation, but that's another thing that um that we addressed too. But I just didn't include that because I didn't want to jump too much. But yes. I guess with constipation, there could be a lot of causes to it. But just some quick tips, like let's say if somebody wants to use the bathroom, if they want to do number two, some things that can your posture when you sit on the toilet can decrease the chance of constipation. So for example, if I'm sitting on the toilet, I can't really show you, but if you have like some kind of a stool to put your feet on, it's called like a squatty potty, where it'll raise your feet up, just so your knees are above your hips, right? But if you don't have a stool, you can even and I'm inside my car, guys, so that's why we're here. But also, if you just bring up your heels, because then that'll pick up your knees, and if you lean forward with a straight back, that'll make the pathway to poop much easier. So just get a step stool or a squatty potty, and then lean forward as well, and keep a straight back, and also trying to take deep breaths because that'll get the pelvic floor to relax. And also don't push too hard or strain too hard because that'll create more tension. So just trying to breathe, take big breaths from your belly. And by doing that, by relaxing more, by changing our posture, that typically makes it easier if we're constipated. And also just trying to eat more fluids, eat more fiber as well, so it's easier to go to the bathroom. Those are just like quick little tips. But I'm not sure of the cause of the bloating or constipation. There could be a lot of causes, but those are just like quick tips that someone can try right now to see if it works. That's a good question, Film One. Thanks for asking.
Great, Jonas. Any questions?
Cool. No
Any?
questions. Great. That's good.
Uh, so if there's any question, I have also another question. So you actually, this is very interesting. Like when I see for the 40 p like for the 40 years old people, there's like 40% they have this erectile dysfunction, and then for the 50-50, for 60-60, and for 70-70%, and things like that.
Right.
Uh, but the other thing is also that interesting that you mentioned it, that it's basically it's an indicator if we have some issue with our heart. And then the other like stress also can, can play a role in those ones too. So, is there a way you can distinguish if it is from either from its stress or if that from our heart? Like, what is the main cause? Is there a way of distinguishing between the two causes?
Well, I'd say, I mean, if a male has erectile dysfunction and if there's an issue, it's best to first talk to your medical doctor, to your primary care doctor, and then they'll do their assessment, right? Especially if it has to do with the heart. Because I'm just a physical therapist, but if there's like a medical issue with the heart, yes. But I mean, it's good to just check your vitals, to check your blood pressure. Um, that's a good investment just to buy a blood pressure cuff, just to monitor it to see if it's high or not. Um, yeah. What's your question again, Nasali? Wait, so is your question like what's the way to determine if it's from stress or if it's an issue with your heart, right? That's a question.
Yeah, yeah, yeah. If it is because of the blood flow issue in mainly the heart, or and sometimes also it could be of the stress or other factors. I don't
Yeah,
know if
yep.
there's a way of distinguishing between these the two. Like I know stress can be reduced, but the heart issue is, of course, that it could be another major issue. So,
Yeah, 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 yeah. I mean, during my assessments, I always ask questions for red flags. Like if they feel dizzy, if they're lightheaded, if they have some kind of a headache, if they have numbness, tingling, and then if they have an answer that's a yes to those questions, then it might be a red flag, and then I'll refer them to their primary care doctor, and then see them. But yeah, I mean, I would check their vitals, check their heart rate, and then see if there's anything off there. Yeah, it's kind of tough though, but I would, yeah, that's a good question.
and then the other thing is also, I don't know, I'm the one always dominating. I think let me give them the other people chance to ask questions. Any questions? Or here, let's see.
Yes,
From Simon, go ahead.
no, I believe but they may not be able to unmute, so unmute to
Okay. Um, okay. I
Oh,
think
because
there's
they
some
can't
issue. There
unmute
is
themselves.
issue with the connection. Yeah, I don't know how to. Maybe have to make them co-host all of them. Let's see.
Yeah, yeah, yeah. So I think I can click on ask to unmute for all of them. I think I just did that right now.
Yeah, can you do that? So maybe that could be the issue.
Yeah, sorry guys. So hang on, I'm gonna mute and then unmute maybe. Let's see. Or
All right, I don't think so you can ask.
Okay.
yeah, they're able to unmute themselves now if they have a question. I just changed the setting.
Okay. Thank you, Yonas. So if you have any questions, can like Filmon, Mike, Burhane.
Ooh.
Okay. So the other question is what I have is like let's say if there's this erectile dysfunction or something, if there's issue down there, Um, I mean, it's good to talk to a doctor. So which doctor is, the appropriate, like our normal doctor or like a physical therapist?
Yeah,
Who is
so
the right person?
probably their urologist. But yeah.
Mhm.
So with physical therapy, I mean, there is direct access where you can see them without seeing medical doctor. But it's always good to be in contact with your urologist, which they focus on the urinary system, which is kind of where the pelvic floor is. But if you don't have one, you can just seek out your primary care doctor, and then they'll refer you to a urologist.
Okay, the neurologists are the one, the people who deal with the nerves are the one can help with that issue. Okay, I see.
Yep.
And then the other one is like, how often do we need to visit our doctor, especially for the prostate cancer? I mean, it's curable, but the only thing is, they have to catch it like at the beginning, like first stage or second stage. I know it depends on the age. Usually when you go, they do this vital checkup and then blood. I
Mhm.
think they can check it through blood. Am I right?
I believe so. Yes. Yes. Yep. Yep.
Mm.
They can do that. They also do like a digital rectal exam. Yep. Where they, yep. But it could save someone's life. So I think it's very important. It's to do. And then yeah, if it's not if there is a history of prostate issues, then get checked once you're 40. If there's no issues, then you can get checked once you're age 50 and above.
I see, I see.
Yep.
Okay. I mean, this is very interesting. Thank you so much, Jonas.
Oh yeah.
Do we have any questions?
Thank you, Jonas. We appreciate it.
Thanks, guys. Thanks for being open to these topics that no one talks about,
Yeah,
that
it's
everyone
very
has issues.
interesting.
So,
Yeah, it's very interesting, Jonas. Thank you on the behalf of the AOC. I thank
Thank
you.
you so much. Thank you, Yonas. Thank you, Desale.
Yeah, thank you, everybody. Yeah,
Very
it's very
good.
helpful. Yeah, we are proud of you, and then keep it up. Thank you, everybody, for coming. So this will be this is already basically we're recording it, and then John is gonna post it on our Viber group. So thank you. Take care. Okay. Thank you, Anasako, and
dang it, Sally. I'll see you
yes,
around. This is good.
yes,
Appreciate it.
bye,
Thank you.
bye.